COVID-19's relentless spread has reached this Glasgow care home. A suspected outbreak of coronavirus taking 13 residents in a week. 2 members of staff are in hospital with the virus, while the home closely monitors the health of everyone who lives and works here. The government says another 708 people have died in UK hospitals since 5 p.m. on Thursday, the highest number of deaths in a day. Today, Cabinet Minister Michael Gove reported startling rises in people being admitted to hospital in particular parts of the country.
The pattern of hospital admissions in England and Wales has regional differences. In London, the number of admissions fell slightly between the 1st and 2nd of April. Admissions are steady in Wales, but in Yorkshire and the North East, they've gone up by 35%. And in the Midlands, the rate of hospital admissions has gone up by 47%.
Today, Watford General in Hertfordshire closed its A&E in a COVID-19 related critical incident. A problem with oxygen equipment meant it couldn't take any more patients. There was some hopeful news in some places. Hospital numbers have plateaued in London, but the medical message was that the future of the virus is in our hands.
There is reason to be hopeful that some of the changes that we are observing in infections and perhaps in hospitalisations is now reflecting the benefit of the social distancing that everybody is complying with. But it will still take time for that to have its maximum effect.
The government said 7 health workers have now died of COVID-19. In London, there was news that 3 bus drivers and 2 controllers have died of the virus. Their union is calling for transport workers to get protective equipment. While the government has far to go to test people for the virus at scale, an app which crunches information supplied by working-age people with symptoms and without has found just under 5% would be positive if tested. Extrapolating to the whole UK population, the data suggests that in the last fortnight, an estimated 1.9 million people have been infected with COVID-19, with hotspots in major cities and South Wales. Looking at the team's interactive map, the data collected from people in Birmingham suggests 6% have coronavirus symptoms. In Liverpool, again, it's just over 6%. And in Glasgow, the data suggests 4% could have the virus.
When you look at the map and you see what's going on in South Wales, where there are peaks there that aren't necessarily in where you'd expect right in Cardiff, but in some of those other areas that don't have much in the way of NHS facilities. So potentially, this would allow people, give them 3 weeks grace to try and mobilise things in some of these areas and maybe move them away from other areas. And also, if you look at the map, you see Liverpool has more problems relatively than Manchester. And so that could be helpful to people as well.
In a move to stem the spread of coronavirus in jail, around 4,000 selected low-risk prisoners in England and Wales are going to be temporarily freed, although tagged. The government wouldn't put a date on when the country, under lockdown, will have a bit more freedom. The Prime Minister, after a temperature yesterday, is still behind closed doors. His fiancée, Carrie Symonds, who's pregnant, has spent a week in bed with symptoms but says she's now on the mend.
Jane Dith there. And later in the programme, we'll hear from families of prisoners concerned about the spread of the virus inside jails. Now, 212 patients in the Midlands have died after testing positive for coronavirus in the last 24 hours. Far more even than London, with hospital admission rates in the region up by almost 50%. With intense pressure on emergency departments, work to complete the new temporary Nightingale Hospital in Birmingham's National Exhibition Centre is being ramped up. One intensive care consultant in the Midlands has told Channel 4 News he feels his team are at greater risk because of a lack of staffing. Our Home Affairs correspondent Darshana Soni has this.
Eerily empty. Silent streets on what would normally be the busiest shopping day of the week, although not everybody can stay at home, of course. This region has now topped a grim chart, ahead of even London. The latest figures show there are 127 deaths from coronavirus in London in the last 24 hours. In the Midlands, the death rate soared to 212, nearly doubling that of London, by far the highest in England. At Birmingham's NEC, they're working on the UK's biggest field hospital, which will eventually have more capacity than London's Excel. Next to the NEC at the airport, work has begun on a temporary mortuary in preparation for an expected rise in deaths. The authorities are trying to understand why this region is such a hotspot for transmissions. There's a real concern that hospitals in the West Midlands will have reached maximum capacity by next weekend. We've spoken to an intensive care consultant who works inside one of these hospitals, treating coronavirus patients. They've described the situation on the wards as being in a war.
In normal times, the guidelines are you have one intensive care unit nurse for every patient. You have up to 12 patients for a consultant. It will end up being up to 5 patients for every ICU nurse and 50 patients for one consultant. This is going to be intensive care that is almost like disaster medicine. We're going to have a lot of deaths, a lot of mistakes, a lot of things missed.
This account comes as the latest figures show hospital admission rates are up by 47% in the Midlands. So why have there been so many cases in this region? Birmingham is England's second biggest city by population, with 1.1 million residents, so a high number of cases is not unexpected. But some commentators and a local MP have suggested cultural and religious practices could also be playing a part, as well as the predominance of multi-generational families here. Unhelpful speculation, according to one researcher who says we need more facts.
You can't sort of place that on the fact that there is a high ethnic minority population in Birmingham, because the ethnic minority population in London is so much higher. Up until the point at which we know the facts of who's caught the disease, who's died from it, and we've got sort of ethnic breakdowns of that, regional breakdowns of that, breakdowns by socioeconomic characteristics, can we then start to make sort of conclusions about it?
1 in 5 deaths from coronavirus in England have happened in the Midlands. The intensive care consultant we spoke to has these fears.
At some point, we are going to end up having to say no to some patients because the politicians have decided they don't want to take responsibility. It will rest with frontline staff. When you are faced with that decision, when you have 1 ventilator and 2 patients, who do you pick? There are no easy answers here.
Public health officials are examining transmission patterns in the Midlands to see if there's anything unusual happening here, but the results could take weeks or even months. The fears there of one intensive care consultant speaking to us. He has been treating intensive care patients infected with this disease. We did put their concerns to the Department of Health, and we were given a statement in which they said, "We're working hard to make sure that the NHS has enough capacity to meet this increased demand." They pointed out, for example, that thousands more ventilators are due to come on board in the next weeks and months. They also stated that the NHS will receive everything it needs to respond to this virus. It comes at a worrying time for this region, as we've seen hospital admissions have gone up by 47%. And in the last 24 hours, the number of people dying who have been tested positive for coronavirus has surpassed that even of London. And we're told the worst is yet still to come because this epidemic hasn't yet reached its peak.
Thanks very much, Darshana. Well, as questions over testing continue, one virologist has been part of a team working on a test in her spare time, in conjunction with Hampshire Hospital's NHS Foundations Trust. Dr. Veronica Fowler, a molecular virologist with a background in veterinary health, is working on a test which she says can give a positive result for someone suffering from COVID-19 within 20 minutes, sometimes as quick as 10 minutes. A game changer if the government adopted it as part of their testing strategy. Dr. Fowler has spent today developing a workflow to introduce this test into the health service. And she told us Public Health England are seriously looking at rolling this out. Well, I spoke to her a little earlier, along with Dr. Stephen Kidd, whose call she answered to work on this project.
OK, so this test is an isothermal test, which means that it runs at a single temperature. The existing test that's used in laboratories at the moment requires multiple different temperatures. So high temperatures, low temperatures, high temperatures, low temperatures, which means you need more sophisticated equipment to be running those tests. Ours is an isothermal method, which runs at a constant 65 degrees for 20 minutes. And therefore, it's a much more simpler test. You need less sophisticated equipment.
So that single temperature reduces the time by how much?
Quite significantly. So we're able to report with this in 20 minutes, whereas the standard test that's in the laboratories is 1 hour and 15.
Now, Victoria, you normally work on doing this testing with animals, so how have you had to adapt your way of working?
So in my previous research career, I have used this particular test for diagnosing OIE listed diseases in research settings, so those diseases like foot and mouth disease. Really, there is no adaptation required. It's so simple to use. You can roll it out into any setting that you wish to use it in, and at the moment we have it running in a laboratory setting.
And a lot of the skills base, which is in veterinary science, it is in clinical science, is very transferable between specialties, so people can get trained up for the different environments very quickly.
Now, we believe you're the first in the UK doing this. Do you think it should be rolled out more widely?
So basically what we have developed is a user-friendly rapid test, which can be used in multiple different formats, and that allows us to apply it in the bottlenecks of the current testing systems. And that allows us to increase the time at which we're reporting. It allows us to increase the number of samples that we are testing, and it enables us to reduce the amount of critical reagents that we are also using in the lab. So it's a really good way to be able to be efficient with time and resources.
So if you were to roll this out more widely, how many people could you test in an hour?
So we can do hundreds in an hour, and we can do thousands in a day. It's a very scalable technology, and that is purely due to the fact that it is simple and that it's very quick. So, we can have a rapid turnaround in 20 minutes.
Now, the government's target is to hit 100,000 tests a day. Do you then think that's viable?
So I think for us, all hospitals will be looking to ramp up as much as they can. So every hospital will be doing their best to use the technology at their disposal, and we'll be using this to add into that number to make sure that there's enough tests in the NHS as soon as possible.
And how are you hoping to share out the testing knowledge that you've acquired more widely across the UK?
We always like to, any innovation we've come up, and a lot of innovation has been driven around COVID, to be able to scale up, we always look to share as much as this with whoever needs and requires that help.
We're hearing a lot about false negatives from some types of tests. Is there any concern about that with the test that you're working on?
Absolutely not.
So it would be much more reliable than some of the tests that are out there on the market?
Yeah, the way that we're going to apply it is part of a pipeline, and we've very carefully thought out exactly where and when it will be applied, and we don't anticipate any problems with false positives or false negatives.
How can you be so certain it's accurate?
We've compared this test directly to the gold standard that is currently being used on a daily basis.
But do you believe it should be and could be rolled out more widely to members of the public?
Absolutely. I mean, as I said earlier, this is a technology that can be located wherever you want it to be located.
So is it something potentially we could all be doing at home and then send off the result?
No. It will still be in some form of centralised facility, even if that's a remote centralised facility.